Lindsay is a very good and effective representative of the establishment. Does Lindsay have a concern that we are the only major country on earth not to guarantee health care to all people? That some 60,000 people a year die because they don't get to a doctor on time? I didn't hear much about that in that opening statement. Lindsay care that we have the highest prices in the world for prescription drugs, and that the pharmaceutical industry right now has 1,500 paid lobbyists in Washington, D.C. to make sure that in some cases we pay 10 times more for the medicine that we need?
That was Senator Bernie Sanders debating Senator Lindsey Graham on the issue of health care. And that topic is definitely timely, considering the fact that a new study indicates that literally hundreds of thousands of Americans could have been living today had they had access to universal health care during the pandemic. This is a study that was just published in the Proceedings of the National Academy of Sciences, and here are their findings. The lead author, Allison Gallivanis, looked into, I want to get into their methodology to explain how they found the numbers here. They looked at the mortality risks of COVID-19 among people with and without insurance, as well as their risks of all other causes of deaths. The researchers compiled population characteristics of all uninsured Americans during the pandemic, controlling for all sorts of factors, including age, life expectancy, the elevation in mortality associated with lack of insurance, all of that. So let's get to the details. What did they find? The researchers calculated that 131,438 people in total could have been saved from dying of COVID in 2020 alone, and more than 200,000 additional deaths from COVID-19 could have been averted since then, bringing the total through March 12, 2022 to more than 338,000 people. That's how many people could have lived if they had health care during a deadly pandemic. Now, it's possible that this study is actually underestimating the number of lives that could have been saved had we actually had a healthcare system in this country that made sense. Having consistent access to care can prevent chronic disease from occurring and can ensure that patients who develop chronic disease have it better managed. I would think that if one took that into account, the estimates of avoided deaths would be greater than the numbers reported here, and that's according to Ann Keller from UC Berkeley. She's an associate professor of health policy and management. And the other thing I want to mention is just how much money having a system like Medicare for All, for instance, would actually save. Our current system is incredibly expensive, but that is not what Lindsey Graham would have you believe. In fact, during his debate with Bernie Sanders, he uttered the same BS lies that we hear from corporate Republicans and corporate Democrats, to be quite honest. Let's watch.
I'd like to lower healthcare costs, but I'm not going to take away your private coverage. You're going to take private healthcare away from 200 million Americans, put us all under the government umbrella. It's going to cost about $40 trillion. In 2034, we'll be spending as much to maintain Medicare for all as we do for the entire federal government today.
Now, of course, one of the favorites, one of the darlings of the private healthcare industry, especially when it comes to legalized bribes, would lie and utter those claims. But the researchers of this study found that a single-payer healthcare system would actually generate savings in 3 ways: more efficient investment in preventative care, so take care of people before they get super sick, lowered administrative costs, and increased negotiating power for pharmaceuticals, equipment, and fees. This would ultimately produce a net savings. Let me repeat that, a net savings of $459 billion in 2020 and $438 billion in a non-pandemic year, according to the authors of this study. Jay.
Okay. So first thing I want to emphasize is that these are real scientists. This is in Scientific American. This is not a political article in terms of the numbers that you're seeing, both in the death rates and in the amount of money that we save. So what scientists don't do is just make up stuff. They study it. They look at all the different factors. They then take out the different factors that might affect it, like age, background, did you already have diseases, etc. They did all of that. There's a terrific study, and it's no joke, guys. And like we treat it like, oh, it's no big deal or it's theoretical. No, 338,000 people died because we have a system where we kill people for profit. No other developed nation has this system. They all have single payer. They all have universal healthcare coverage for two reasons. One, it's shown indisputably in every country that's ever done it that it's lower price and better results. So it's already, that debate is already over. Everything else you see in America is a lie. The media is lying to you, the politicians are lying to you. That debate worldwide is 100% over. Everyone needs to be in universal healthcare just on costs and results alone, but I've got part two.
I just want to go to graphic 6 while you're making that point, because graphic 6 is a graph that shows you how the United States fares compared to all of these other developed countries, healthcare system performance compared to spending. And as you can see, all of these other countries actually spend far less on their healthcare and provide far better results. And we've talked about that over and over again. So I just wanted to provide some evidence to what Cenk is saying here.
Yeah, and so part of the lies is what Lindsey Graham just did, where he says, well, you're gonna lose your private insurance. And so look, if the Republicans said such a stupid, outrageous lie, I just say, okay, yeah, they're protecting their donors, etc. But the media repeats that lie over, mainstream media, over and over again. That's Jake Tapper's favorite lie. It's cable news's favorite lie. So why do I call it a lie? So I asked one of the biggest opponents of Medicare for All, Michael Bennett. He's a corporate Democrat from Colorado. He was running for president. I asked him 2 different times. I said, look, you guys keep saying it takes away private insurance, but it gives you better insurance that covers more coverage. In fact, it's universal coverage, and you could choose any doctor you want. Isn't that true? And he said, oh yeah, that's definitely true. It's the quote unquote Cadillac package. So what difference does it make if it takes away your private insurance and replaces it with better insurance?
Well, his donors don't like the Cadillac package.
Yeah, and you get better coverage and any doctor you want. What earthly difference? But they frame it like, oh, as a private insurance is good. You guys have private insurance. Is it good? Is it like, oh, you get anything you want? You go to any doctor? No, you got to be in network. You can't be out of network. There's lines after lines after lines. It's super expensive premiums deductibles. They're like, oh, they'll take that away and just give you insurance for free. Ooh, that covers everything. Ooh, well, that sounds so bad. No, it's a fundamental lie. Lindsey Graham's a liar. If anybody you see on cable news repeating that, they're doing that for propaganda purposes. So, and then finally, look, there's the moral argument. Are we really gonna let over 300,000 people die so that corporate executives and totally needless private insurance companies make billions in profits?
Yes, we are. Yeah. We've already done it. We've already done it.
So, and understand that everyone who's opposed to universal healthcare coverage or Medicare for All says, yes, we should let them die so that my donors can make more money. That's just a fact. It's an absolute, irrefutable fact. Thanks for watching The Young Turks. We really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.